One of the ways you can get away from cord is with the product from Premier called Traxodent. And Traxodent, for me, has become a staple in what I do day in and day out. Traxodent is a hemodent paste retraction system that not only provides hemostasis, but it also provides retraction. How does it do it? First of all, it has 15% aluminum chloride in it. The paste is already preloaded into the syringes, so there's nothing for you to do but take your syringe out, put a tip on, you're ready to go. You can bend the tip if you like, in order for you to achieve ease of access on the distals of second molars. Within the paste, there's an ability for that paste to give you mechanical displacement of the tissue. So between the 15% aluminum chloride giving you hemostasis and the paste being able to push tissue away, when you rinse it off, the sulcus is dry because that clay paste absorbs fluid and expands, giving you that feel like you've placed a number 2 cord in the sulcus. So you could have a bleeding area, as I'll show you in a second. You could have one that doesn't bleed. It'll give you the retraction that you need. And even though you rinse it off, when you dry it, that sulcus remains bone dry. When would I use this? I use this in any form of crown and bridge impressions. I use this if I have a class 5 that I need to have some tissue retraction and hemostasis. I might use it in a class 2 where I have a subgingival box and I need some retraction and hemostasis. So for an inlay or an onlay prior to impressioning. So the bottom line is, the goal is to get rid of curvicular fluid, to get rid of blood, anything that will interfere with an impression, and we can do that by placing the Traxodent into the sulcus. So the bottom line is, Traxodent itself will do the trick, but the kit also comes with something called a retraction cap, and that is basically a piece of cotton that's cut out in 3 sizes, small, medium, large, depending on your size of your prep. And when you place it over the prep and the patient bites into it, he is now forcing the Traxodent paste further into the sulcus, giving you better hemostasis and better retraction.